Local programming on KRWG Public Media made possible in part by viewers like you. Thank you.
This is KRWG Public Media, TV, radio, online. News that matters. Now, across the Mesilla Valley and the borderland, the stories that shape our community. From the KRWG Broadcast Center at New Mexico State University, this is Newsmakers.
Thank you for joining us on this edition of Newsmakers. I'm Madison Staten. With COVID-19 cases on the rise, finding new and effective treatments remains a top priority for researchers. I visited Texas Tech University Health Sciences Center El Paso to find out how one localized trial is seeking to help patients recover faster. For Dr. Edward Michelson, making a meaningful difference in society isn't just a token philosophy. It's what drives his work every single day in the fight against COVID-19. As the chair of emergency medicine at Texas Tech University Health Sciences Center El Paso, he strives to help residents and faculty members alike feel that they are making a true difference in the medical field. And he's not afraid to lead by example. He's the brain behind a localized trial, studying the effects of an anti-inflammatory drug, cromolyn sodium, on hospital patients with COVID-19. Michelson is hoping the use of cromolyn sodium on COVID-19 patients will help speed up recovery.
Although none of us wants to be dealing with this pandemic, I'm actually pleased that I'm here in El Paso during the time of this pandemic and that I can do this work here at Texas Tech and at University Medical Center. We are enrolling patients with COVID-19 who've been admitted to the hospital because they require oxygen, and we're treating them with the cromolyn sodium. They receive 4 days of nebulization treatments, which is something you would use in asthmatics. And this is to deliver the medication into the lungs, where a lot of the injury from COVID takes place.
The trial, which is entering its second phase, is seeking to enroll 50 patients in a randomized double-blind study. Half the patients will receive the active drug, the other, a placebo. If proven effective, Michelson says the findings could help COVID-19 patients on an international scale, due to both the ease of access and general affordability of the drug.
This is a very inexpensive generic medication that will help particularly those areas with less resources than we have here in the United States. It could be easily deployed, it's easily given, and has great potential to help a lot of people because of its accessibility.
The trial is being supported by a $1.7 million grant from the National Institutes of Health, given to TTU-HSC to fund multiple COVID-19 treatment trials. This ongoing research is of particular importance as COVID-19 cases continue to increase. Helping the borderland community through the pandemic is a top priority for Michelson, who says local initiatives like research and public health education efforts can make a true difference.
It really gives us a great sense of purpose that we can be a part of helping the community, helping to educate individuals about the disease, encouraging important practices like getting vaccinated, safe practices, wearing your mask, and then to also be able to participate in cutting-edge research kind of rounds out the picture.
Michelson hopes to have results from the cromolyn sodium trial this spring. To talk more about COVID-19 in the borderlands, we are joined by Dr. Dolores Gomez, the Chief Medical Officer at Memorial Medical Center. Welcome to the program.
Thank you for having me today.
Yeah, it's lovely for you to be here. So what does our audience need to know about this new variant? How does it differ from past iterations of the virus?
So there's some good news with the current variant, but of course there's some bad news along with it. So if you want to compare it to our last variant that we had, Delta, the Omicron variant is much more contagious. So it takes, there's a lot higher viral load when you get exposed. So there's a greater chance that you can get infected with it. They think that's about a 3 or 4-fold difference in contagiousness versus the Delta virus. The good news that we've seen thus far, at least from it, is if you have been vaccinated and you do happen to have a breakthrough infection, and even in some of our unvaccinated patients with lower health risks, it doesn't seem to cause as much hospitalization or severe disease, but we are still seeing that as well. So those are kind of some of the biggest things that we're seeing in the differences between Delta and Omicron.
So are you expecting the rate of COVID-19 cases to continue to rise in our area?
Yeah, I think New Mexico right now, and definitely in Doña Ana, I think we're just on that really high upslope of it right now. If you look throughout the country right now, which is pretty much all Omicron in nature, some of the cities that have been hit hardest, you're already seeing them starting to come down on the downslope. And it's pretty much following what they've seen in South Africa, that there's this rapid rise up for several weeks. And then the nice thing is there's been a rapid decline in it. I think in New Mexico, though, we're still on that upslope right now.
So we're seeing cases where people are getting both the flu and COVID at the same time. So in what ways is flu season impacting this latest spike?
Yeah, a little bit different now. They're now kind of calling that flu-rona, where we're seeing people have both COVID-19 and the flu at the same time. Obviously, having two infections at once definitely puts you at greater risk for the need for hospitalization or having a more severe illness at the same time. And we're definitely seeing more flu this year in comparison to last year. And I think that's for various reasons. One is I think we were much more vigilant last year without the vaccine of wearing our masks. And so there's a little bit more exposure. But the flu vaccine that was given this year was really based on the 2019 flu. Every year, our flu shot is based on the previous year. Since we had such a low number last year, they're using the variant from 2019, so we're not seeing as much effectiveness of the flu shot this year. So that's seeing that rise in flu cases, and then combining that with COVID-19 definitely makes for not a very safe mixture for more hospitalizations because of that.
Well, speaking of more hospitalizations, in what ways are you seeing this specific variant impact Memorial Medical Center?
Yeah, it's a little different than last year and how we dealt with our surge at that time, because it was a lot of COVID cases taking up our beds. We still have COVID cases, but because we are now in such a crunch for staffing, we may have beds, but we don't have staff to take care of the patients. And so it's a little bit different, although it's a roundabout way that's saying that COVID's still affecting us in that way. With the lack of staff, it makes us even more vulnerable to be unable to take care of people outside of COVID as well, because we just don't have enough staffing to do that.
Well, speaking of staffing, how have staffing shortages, we've seen those nationally, been impacting Memorial Medical?
It definitely is impacting us. It's impacting our sister hospital at Mountain View as well. We're seeing that, and it's for a variety of reasons. Some people will say, well, it's the mandate of the vaccine, and there are staff that aren't interested in that. I think that's a very small piece of it. I think it's been tough from a fatigue standpoint. We went through this couple of surges last year. Nursing staff, respiratory staff, they're tired. They've chosen maybe that this isn't their career path anymore because they saw so much. And then we're also losing nurses because they're getting traveling jobs. They're going to areas where there is a higher need for the nurses. And unfortunately, then it leaves these smaller community facilities without that staff available to us. So that's how we've been impacted mostly. We're not unique or immune to that in any way in what you hear on national news.
So what do you think that the general public needs to understand about this mental strain on our healthcare workers?
I wish there was a way for them to see how it has impacted. And it's not only impacted the direct patient care, it's definitely impacted even everything around that. The people that are responsible for keeping the hospital clean, our security staff that have to deal day in and day out sometimes with people who are unhappy because we're not doing visitation again in the hospital because we're trying to maintain as much safety that we can to our staff and to the public. When you do that for a short window of time, I think we all can kind of recover and get back. It's almost like a boxer who kind of gets knocked down and you come back up and then you get knocked down again. It's just a continual impact over and over to everybody. And that emotional and physical strain has been very difficult. And I don't want anybody to have to see what the staff is going through, but sometimes you almost wish you could give a little bit of a glimpse of that. And maybe there can be a little more reality and understanding how we have to do this as a community. It can't just be the hospital trying to take on all of this burden.
And what is your message to those who are just experiencing pandemic fatigue, that just want this pandemic to be over?
I would say that we have to keep doing what we have been told from the very beginning of this. We still have to mask. We still have to socially distance. We all got a little taste of what it was like that maybe this was kind of ending, and then it's hard to kind of take that step back again. But we have to keep doing it. And if the message from me can be heard this time, please get your vaccine. If you haven't, please get your booster, because yes, those boosters can help make a difference. People are very worried because they hear, well, even people who are vaccinated are getting sick. That's true, but there's a less likelihood that they're going to end up in the hospital and end up with much more severe disease and continue to put that burden on our hospital staff.
So do you think that the current state guidelines are sufficient when it comes to addressing this new variant?
I think that that what the governor's doing right now is definitely helpful. I think we have to kind of stay the course. I also know that it's difficult to say, well, gosh, do we need a lockdown again? Because we know that when that happened financially and what has happened within the state of New Mexico and within the U.S. and globally, is that shutting down is not necessarily the best answer. But if we don't have everybody on board on what we need to do, those shutdowns could happen again if we're not careful. So I think she's doing all of the right things. It's just really hard because she has the pressures, the state has the pressures, the U.S. has these pressures that we have to keep moving forward. But it's hard to move forward when we continue to take 2 and 3 steps back.
Well, would you encourage people to personally lock down more than they have been before?
I think right now where we are, and like I said, that in Doniana, in New Mexico, we are still in that upswing of the surge right now, that I think, yes, we need to do that. Having some of those family gatherings again may need to go away. Hopefully the good news with this, because we have seen that rapid upslope, but then also a rapid decline, is that maybe in a few weeks we can be back to, maybe we can gather a little bit more. But if we can kind of stay away from those large gatherings, stay away from indoor venues where there's a lot of people, I think we need to do that right now.
So speaking of national guidelines, we've seen guidelines change about quarantine. How long should people be quarantining after that first positive test?
Yeah, so right now what the CDC has updated their guidelines on is that if you are symptomatic and you start to see improvement in your symptoms, and that's the key, you have to be getting better, then after 5 days, you may be able to return to your activities, but you will still be required to use a well-fitting mask for another 5 days. So it still is that 10-day window that was there before. It's just being able to say, can we have people get out again? And right now, we talked about the healthcare shortage. It's really hard when you have people out, and we have seen a lot more of our staff having to go out sick with COVID, which then further burdens us with that healthcare shortage. That if there's that ability and the patient is feeling better, the person is feeling better, that they can get back as early as 5 days. If symptoms are improving and they are no longer febrile without using any medicines to lower their fever, then you can get back at 5 days. So it's still the same guidelines. It's just letting you get back and out a little bit sooner if you're feeling better.
So if you're living with others, potentially in a bigger family with older relatives, if you yourself are exposed, what are the steps that you can take to ensure that the rest of your family isn't exposed to the virus?
Yeah, so you definitely have to isolate, and isolation is a little different than quarantine. People get a little confused with that. So if you are positive and you are symptomatic, you need to isolate yourself from other members. If you have the ability to maybe get out of the house, maybe go stay at another location where you will be on your own, that would be the best. If that's not feasible, then keep yourself on one side of the house. Don't share bathrooms. If you have to come out, you should have your mask on. Consider gloving and frequent hand washing in order to decrease that risk of exposure to those that are still in the home with you.
Well, we've also seen at-home tests become increasingly more common. How reliable are these tests, and should people who have potential exposure rely on them?
Yeah, so they are a really good option once you have symptoms and if your test is positive. So when we talk in the science world, we talk about a sensitivity of a test or a specificity of a test. So a test that can tell you if it comes out positive and you can be guaranteed that it's positive, those rapid at-home tests are really good at that. What they're not good at is sometimes you can have false negatives. So they have a lower sensitivity. So if you have a negative and you're symptomatic, you either need to consider going and getting the PCR test, which is looking more at the DNA part of the virus versus the antigen tests, which are what our home tests are, or you need to retest within 48 to 72 hours, again, to ensure are you truly negative or not.
And just to remind our audience, where can they go in the Las Cruces area to get, tested?
So there are a lot of areas that you can go within Las Cruces. Several of our pharmacies are offering testing. We have several of our labs that offer that as well. Of course, we have our outpatient lab here at the hospital to do that as well. The best place to know if you don't know where to go is definitely go to our Department of Health website. Because there they will have a list, even if you're not in Las Cruces, if you're in the Anthony area or anywhere else, of other locations that you can go to. There are hours for them. I will say that there are some very long wait lines right now because a lot of people are requiring testing. The one place, if you just need testing and you are not that ill, that we are saying please do not go to, is don't go to our emergency rooms. Our emergency rooms are very overwhelmed right now. We need to take care of those patients that are needing emergent care. We will see you if you come, but there are a lot of other locations for you just to go get tested if needed.
And we know not every mask is created equal, especially with the new variant. What should people be aware of when going to purchase new masks?
Yeah, so that guideline has changed back and forth. Right now, at least with Omicron, it seems like the cloth masks are not going to be as protective. Of course, any mask is better than no mask. So if all you have is cloth masks, that's going to be better than no mask at all. They are recommending, even for Omicron, that you need kind of more of that medical grade mask that we use in the hospital, the N95. I don't know if you've seen that the president just announced that they're going to try to get millions of those N95 masks out free to our publics to use. If you can't get that, definitely if you go online, you can find other masks that have very similar ability to protect you. The KN95 mask is one, and then there's another that comes out of South Korea called a KF94. Those are your best masks that you can use. Your next best would be more of a surgical or procedural mask, and then of course better than no mask is at least a cloth mask, and maybe even considering double masking if you need to.
Absolutely. So are you happy with the current rate of booster vaccination for the Las Cruces area?
I would have to say no. I think for whatever reason, people went and got those initial vaccines, which is great, but now they're a little bit worried about the booster. I'm not quite sure why that's in place, whether it was they got vaccinated because there was that need from a mandate standpoint that, the state did put out as well. And then initially that request from the U.S. overall, we still have to keep doing it. And it may be, at least at this point, it looks like we may have to booster a little more often until we can get this under better control. Again, it's a public health need. It's not meant to take away anybody's rights or freedoms in any way. It's a public health crisis that we're dealing with. We are still in a pandemic. We want to get this to a point where maybe we don't have to do this as often, but we're definitely not there yet, and we need to continue to do everything we can, including vaccination and boosters.
What about as a state? What vaccination trends are we seeing there?
So in New Mexico, the good news is we've always been at the forefront in terms of getting vaccines done sooner rather than later. In the state overall, we're almost at about that 70% level for having full immunization. The county itself, we're a little bit higher than that. We're about 72%, which is really good. But what we're seeing, very early on in this, people talked about getting to herd immunity, where there's enough of us vaccinated or those that have been exposed and have been infected, that if we could get to that 75% range, maybe we would start seeing things different. But Omicron, unfortunately, really changed that. And so we probably will need to be in the 90, 100% range. And people are now starting to talk about herd immunity isn't going to make a difference. We just need to do everything we can to prevent and protect ourselves as much as we can. So encouragement to continue to vaccinate and to continue to booster.
Do you think that people who have already received a booster, will there be a potential for another?
I think right now, looking at the science and the data right now, it does look like that's going to happen. There's been a little bit of a change already about what's your window of getting the booster. For our 2-dose vaccines, they've changed it from 6 months to 5 months. So that's both for the Moderna and the Pfizer. And the Johnson & Johnson is, they're saying, as early as 2 months after your initial full vaccination. There's some data now looking like that might even move down a little bit more. It may be more around 4 months. And I know that worries people, thinking, well, what's the point in me getting vaccinated if I'm not going to be protected that long? There is still some good data that's saying it may keep you out of the hospital. You may still get infected, but your illness will probably be much more mild and the less chance that you'll get severe disease and end up in the hospital.
And what about mixing vaccinations? For instance, if you have a Moderna and a Pfizer, is that okay, or do you need to stick with just one?
Yeah, no, definitely mixing and matching at this point looks like it's okay to do. Definitely where they've seen the best effect is in those that received Johnson & Johnson as their first vaccination. Now going ahead and getting either the Pfizer or the Moderna is okay. It's all right if you stay with the same. I don't think you have to mix and match. The one thing I will say is if you show up somewhere and say, hey, I want to get the vaccine, but I'd prefer to get one of them and it's not available, but they have the other, please still go ahead and get vaccinated, because any vaccine is better than no vaccine.
So besides the vaccine, are there other COVID-19 treatments that are available or will be available to the general public?
Yeah, there are. We have had the monoclonal antibody available for some time now through this pandemic. We had 3 different variations of the monoclonal antibody. Unfortunately, right now with Omicron, it seems like only one of them is effective at this point, the Sotruvimab, and so that is available. And then there are 2 new oral agents that are out there. Has a little bit more time specific. You have to be able to get the oral agent in you within a 5-day window after you start with symptoms. Our difficulty, though, right now nationally is the amount of production of all of those agents right now, because there's such a demand. There's not enough to go around. So right now in our state, it's being allocated within the state. It's going to the areas of highest need. That means in Doña Ana, we may only be receiving a small number of those doses. And I can tell you, it's probably not enough to serve the whole community. If that's any incentive to tell you just don't get infected, get your vaccine if you can, we should do that, because sometimes those treatment options may not be available from a week-to-week basis.
So if you had to make an educated assessment, how do you think the pandemic will continue to impact our community over the next few months?
I think right now with Omicron, we're going to hit a window, hopefully by the beginning of February or so, where we're going to see a nice decline in the amount of infections that we're going to see. The difficult part is, even though maybe in the United States we're doing a really good job of getting more people vaccinated, we're going to continue to see variants and such until kind of we can do this globally. There are still a lot of countries outside of the United States that are only at 20 to 30% vaccination status. So that allows the chance that if this virus continues to mutate and change, that there's always risk of that exposure coming in. We can't stop travel 100%. So I think we're going to continue to see this. I think the hope with Omicron right now, and Dr. Fauci has talked about this a little bit, is given how contagious Omicron is, but not being as severe, that we may reach more of an endemic state where COVID's not going to go away 100%, but it may be more like what we see with the flu every year, where maybe we can have vaccine available to kind of get us through. But I don't think it's going to go away 100%, but can we get down to more of an endemic state where maybe it's not as crushing as we're seeing right now in our community and across the world.
So what are the key takeaways for our audience concerning this new variant? At the end of the day, how would you sum this up?
So at the end of the day, I would say Omicron is very contagious. You get exposed, there's going to be a much more high likelihood that you will get infected. So we need to continue to do our due diligence, continue wearing your mask when you're out in public, wear your mask if you're going to be in an indoor area with a crowd. Wash your hands. That can be just a very simple thing that we all can continue to do. And right now, I think we do need to go back to really socially distancing us from gatherings right now. And then the last thing, please get your vaccine. If you haven't received it, get your booster if you're due for it as well.
So as the Chief Medical Officer, what would be your final message to our audience today?
You know, I try to keep that happy face on and be optimistic. I do want people to know that right now our healthcare system is extremely fatigued. They are really struggling mentally and emotionally right now with all of this going on. Try to look back to the time when everyone said we're healthcare heroes and, you know, we're cheering you on. One way that you can cheer us on is to do all those things that we said. Get your vaccine. Please don't think that this is anything more than a public health emergency. We need to take politics out of it. We need to take away the idea that we're taking away freedoms. It's been hard. It's taken a huge toll on everybody, and even those that are not in direct patient care. It's hard to have these conversations over and over again, and feeling like you're losing that lack of empathy. You never would think that you would do that as someone who gets into this career, but sometimes just the anger and the frustration just builds up, and it makes it really hard to be empathetic. So please take that into consideration, that when we're asking and we're imploring you, please do everything you can so we can get past this.
Well, thank you not only for being here today, but for your service throughout the pandemic.
Thank you so much, and I appreciate this opportunity.
Well, that's our time for now. Join us this week on KRWG Radio every weekday. It's Morning Edition 5 to 9, Fresh Air at 11, followed by Here and Now, noon to 2, and All Things Considered 4 to 7. KRWG News is always online at krwg.org, and we'd love to hear from you. Email us with story ideas and video submissions. The address is feedback@nmsu.edu. For all of us at KRWG News, I'm Madison Staten. Have a great week, everyone. We'll see you next time on Newsmakers.